This is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and welcome back. If you've been with us earlier today, if you're brand new, tuning in now, welcome to our soiree, so to speak. I have with me on our virtual stage, Dr. Erica Bliss, formerly CEO of Q Lions, currently a solo direct primary care practitioner with Equinox Care in Seattle. Also, Clint Flanagan, who is in Colorado. He started his direct primary care practice in 2009, and at the same time had a private fee-for-service practice that he maintained. He's currently in 70 plus locations across the US. Also with us is Brian Forrest, who is CEO of Access Healthcare Direct. He's been doing direct primary care practice for 20 years, and he started helping other practices to move to the DPC model in 2005. And I've had the great pleasure of meeting each of these people back, I think, at the first DPC summit that we held in 2013. And Clint, I think with you, I think it may have been the one in 2014 where we first met. So we've been colleagues for a long time, and I think of each of these as leaders in the direct primary care movement. And I want to thank you for taking the time to share your wisdom with us today. Brian, ball's in your court.
Thanks. It's definitely great to be with all of you today for this reunion, even though it's virtual. So give me just a second. I'm going to share my screen here. All right. Can everybody see that okay? All right. So I think my colleagues have set this up perfectly. You know, I think employers absolutely love DPC once they know what it is. And, you know, Erica and Clint both touched on some great points that we are nimble. We're able to innovate without the barriers that traditional fee-for-service medicine has in front of it. When I do a virtual visit, you know, I never am thinking in the back of my head, well, how do I code for that? Because I don't code for anything. And so I think, when employers learn about what we're doing, they're really excited. And COVID-19, as you know, as horrible as it is, it's been an eye-opener for a lot of those ones that we worked with before it, and also ones that have come to us to work with us since, because they realize they have these needs for employees, you know, and their safety and their health and their well-being and their primary care and their mental health, and they just don't know how to make it work. And the other thing is re-entry into the workplace. You know, how do they safely bring these employees back in and make sure they're doing that in a safe way? So, you know, in parentheses here, I said, you know, what we do, most doctors can't do that. You know, it's very unique, the flexibility that we have to innovate, to do it on a dime. You know, Erica talked about the firefighters, and, you know, she can reach out to those guys and do something immediately in one day. You know, if Clint sees something going on with an employer group and the employer has a need, he can customize a solution right there on the spot and make it available. So I'm going to talk about a couple things. We got to have mandatory faculty disclosures and activity disclaimers, but I'm going to talk about some of the things specifically that we've been doing as a network during COVID-19 to work with employers. And obviously they are facing some tremendous challenges, and we hope everything's going to go back to normal. But you know, as people go back to work, the leaders are very focused on figuring out how to keep their employees healthy. They want, you know, the workplace to be safe, and the screening for COVID-19 is going to be very important to that. You know, knowing how we follow up on employee mental health as well. This has taken quite a toll. You know, we know in primary care that a lot of what we see is mental health related. Well, this has been the straw on the camel's back. This has really pushed things along. And so a lot of vulnerable populations and people and employees maybe that never had any mental health problems before, that may be what's return to work. And a recent survey showed that 78% of people were returning from 47% were concerned about the culture and bringing employees back. So this has really been a big hit for employers. So what we focused on is really three areas. First, screening in the workplace. So we've set up a system through a partner with a virtual artificial intelligence module where any of the employees can go on that and get screened. Those employees then can be directed to get COVID-19 antibody testing. Ones that are positive then can get confirmatory PCR testing, and they all have access to that. And this is regulated. We've got the certifications in place, which makes it easier for people since we're doing technically testing as a high complexity lab to make this available. But we can monitor when it's time for patients to be, for the employees to be able to go back to work. There are patients, but they're employees of the employer and they want them to be able to go back to work. So the first prong of this stool is sort of the screening. The second is ongoing virtual care, and Clint has talked about that a lot. That's something that we were already doing for years before it was doable. All the fee-for-service colleagues of ours felt like they couldn't do it because there was not a way to reimburse for it. Well, we've been doing it for our patients. They're used to it. So it's just a natural transition, even from the office to virtual care for direct primary care. And so giving access for these employees to support them with mental health care, virtual medical care, virtual DPC, and then in-person brick and mortar care when it's needed and when it's safe to do so. And then lastly, measuring patient satisfaction, and letting these employers know, not only are your employees engaged with direct primary care and with this network of providers, we want to tell you how satisfied they are. We'll talk a little bit more about that tool at the end. And then also population status. We can tell an employer what % of their employees have had, chronic IgG antibodies and for how long. That's great information. They can sort of see the ripple of COVID-19 moving through their employee population. We can tell them, what % are in recovery status versus what % are still acutely ill and, infectious kind of thing. So these are the three prongs there. We won't spend a lot of time on this. This is just to give you an idea of sort of the journey that we've made available for employees. And you can see it gives us, sort of buckets to put people in to know, are they safe to work? Are they not safe to work? Should they stay out of work a little longer? Can they work from home? And this is guidance that's really incredibly helpful for the employers and the employees. The virtual triage uses artificial intelligence. So it's an online tool. The computer verbally interviews the patient. So it's a computerized voice, although it sounds fairly natural, that is asking them questions and recording a one-way short video, delivers a summary to the DPC provider, and it's able to pick out symptoms. So if somebody says, well, last week I had a cough and I had a fever and I was around somebody, I had a contact with somebody, it'll literally pull out fever and cough and contact. It will weight those and then give a probability, sort of a report that then goes to the provider and makes it so they can easily know sort of what the next step in triage is. And then the second step is, again, a rapid result screening test with IgM, IgG antibodies. We found a very reliable test that's approved under the FDA for emergency use authorization. We're making that available to all the employers we work with. And then lastly, sometimes we forget about there's vulnerabilities of different patients. And some patients who, maybe they have diabetes, maybe they smoke, maybe they've had stents placed, maybe they're anemic. Those patients are going to be more vulnerable. So the other thing we do is we can assess, with just common basic lab tests and find out where people are, what their vulnerability is, and also help give those patients some guidance about their safety in returning to work and what their real risk is. Personally, in my own practice, I try with every single patient I see now to literally, as evidence-based as I can, give them a risk, a mortality risk based on everything going on with them and COVID-19. And they found that really helpful. 3 days ago, I saw a gentleman who's had a kidney transplant, and it was bad news. I was telling him, look, you've got to do everything you can to stay away from this because you're a transplant patient. But then sometimes I would see, 30, 40-year-olds that were pretty healthy and they were worried about going back to work, or teachers, and they were worried about being back. And I'd say, your risk is pretty low. So I think it's, our ability in primary care to, individualize our advice and our relationship with our patients is really key there. So again, the one-way video screening, the computer is literally recording them answering these questions, but it is actually giving us data. All of us clinicians know if somebody's labored in their breathing and they're on a screen, you're going to be able to see it. If their lips are blue, that's concerning. So this one-way video, it's like a 2-minute clip, is actually very helpful. And then we use key metrics from that based on the CDC guidelines, and guidelines from a medical professional consensus about what that translates into and a patient's readiness to return back to work. Won't spend a whole lot of time on this. This just shows a little bit of the triage. You can see over here, those red sort of outlined words are things that the artificial intelligence actually pulled out of the subjective history of the patient that were sort of red flag words, things like cough and fever and things like that. And then once we get that information, which people can do 24 hours a day on their own computer, on their phone, once we've got that analysis, we then send that to a provider who can give them virtual care, or refer them for testing, or see them in their direct primary care office, usually the same day. So it's really very efficient. And then the second part of that is it makes it so that we can have an ongoing way to monitor the employees. So these employees have access to this AI technology anytime. And going forward, they may report their symptoms are doing better, and we can sort of get an idea as a population of people, how things are going. Is it really severe, or have we reached the peak yet? Very, very helpful information for employers. We're doing this for some of the casinos out in Las Vegas. We're doing this for some school systems. I think Clint mentioned working for some school systems, and then also some big, large universities. And they're finding this is a great way to really have an idea of how their students or their employees are doing, and it also helps them to shape their policy, their work policy. Just real quick for those that haven't heard about the details of testing, there's a blood test that can be a finger prick or whole blood. This is what we use in our offices and can do this and get this result in about 15 minutes. And it's confirmed by a high complexity CLIA certified lab within 15 minutes of us getting the sample. And then also the PCR test, which is usually the nasal swab or oropharyngeal swab. The reason we chose not to do that in our offices for our patients is the exposure. Our employees and staff have to remove the patient's mask to do that. When you have a spot of blood or you do a blood draw, the patient can leave their mask on. So it helps a lot with our ability to preserve our PPE, which has been in very short supply. So this is, again, these are ways to create solutions, get around barriers, and get things done because we're not hampered by worrying about which insurance plan it is and what codes we're going to have to do. In fact, the screening test we do for free for the employers that are enrolled in this program. Like I say, the test that we're using in the office is an IgG/IgM test. Gives an idea about when patients contracted the illness. It does have to be done by a licensed medical professional, but it allows us to work with a company's on-site medical clinic. We can provide drive-up testing at their company parking lot, or they can send their employees to our office and get testing. Any of those options are available. We won't spend a whole lot of time back in medical school on this, but this just gives you an idea of how we're interpreting the results and sort of what we can tell patients and employers about where people stand. We know if somebody's 1 week out from this or if they're 8 weeks out from this based on their antibody pattern. We mentioned before the emotional support. I think it's really going to be important, just as much as the physical health and contagion of patients. There's a lot more emotional burden right now. And so we've reached out to the employers and said, look, we want to do that too. So we want to provide access to that because as my colleagues know, it's very hard to get mental health access for people, especially within the 24-hour period. And sometimes that 24-hour period can be critical. And so we thought this was really important. And we invite all the employees to participate with this. They can do the assessment on their phone. The professionals review their results and then give them guidance based on that. It's confidential, evidence-based tool, looks at, based on some of the questionnaires that you guys are familiar with, predicts future activity, takes less than 10 minutes. And then we can actually follow those people over time. So we can give people an idea of, for lack of a better way to say it, their morale. What is the pulse of their employees? Are they feeling sick? Are they feeling recovered? Are they feeling like that, their company is getting over this? And some of this helps out with that. And then, something else we're doing as a network, just because we have a large GPO, is a lot of employers are having tough times getting PPE too. And so we use our national GPO basically to be able to source these things. So, we've had people that needed 100,000 masks. Well, it's hard to get that right now. My personal medical supplier I used to use for my office is back ordered on everything. I was told by one time that gowns were on intergalactic back order, right? So it was going to be years before we might see them again. So you really have to go to large buying groups to be able to find these things. And employers, especially smaller ones, maybe companies of 50 people, they really appreciate somebody being able to help them source this. So DPC practices, what are they doing? We're doing this triage for them in the COVID setting, providing the rapid antibody screen, giving them that medical support virtually, instant access to that anytime the patient needs it, but we're also giving them, access in the brick and mortar land. And we're also giving them some guidance on sanitization procedures, education, and helping them out with their PPE. And, as I always say, it's a low cost per member per month. Clint and Erica and I are used to the concept that, you're a member, you belong, and we're not just treating you episodic care. And so for these employers, literally for under $5 a month, these employers get access to all of this, to the testing, the screening program, the virtual care, all of that. And so it's really a no-brainer for a lot of them. And in our state, I think we're going to have a lot of gyms who are actually going to want to do this for their clients, because in our state, they haven't wanted to open gyms. They've been very concerned about that. But if a gym could tell their clients, look, we've got a program for you. Gyms are used to billing per member per month. So they would just take part of their per member per month and use it for this program and ensure the safety of their clients in the gym. And so anyway, it's just some examples of things that we've been doing to help people, in the employer space through COVID-19. And then lastly, how do you track what kind of job we're doing? And, Larry had put me in touch with Dr. Rebecca Etz, and she's been, really an important figure in terms of figuring out what's something that truly gives a reflection of how good am I being treated as a patient? How good a job is my doctor doing? And so this is an evidence-based tool, and we're using this with an employer in Charlotte. We're going to be sending it out to all of their employees. They have about 750. We're also going to use this with the university that we're working with right now, that large university. And it helps us to know, are we doing the job we say we're doing? And I think Larry told me one time, he said, if a direct primary care practice can't knock all of these out of the park, nobody can. Nobody can. So that's what we're using as one of the metrics, as a way to sort of gauge patient satisfaction. So I'm going to wrap that up, and I think all three of us are going to open it up for questions.